There is a saying, blood is thicker than water, which means family relations and bonds are always deeper and goes long-lasting than any other relationship. This kind of relationship is so genuine and pure that we are gladly to accept the good and the bad value of each family member because we are a family. But we don't realize because our familial bond, our parents or grandparents may even pass certain genetic disorder or trait to their children and grandchildren. How can this happen? Basically, we inherit a set of chromosomes from our parents, which each chromosome consists of many genes. And the genes contain information to make protein in the body so that our body can develop and functioning. However, when one or more of these genes or chromosomes are missing or altered, or if extra chromosomes are present, certain proteins are not made or made incorrectly. This may result in impairment in development and growth of the individual. Even worse, these faulty chromosomes and genes can be passed down from generations. Every year, it is reported 3% of the baby born in Malaysia suffer with congenital abnormalities, which include genetic disorder, chromosomal disorder, and inherited metabolic diseases. Some disorders can be presented at birth, but some later in life. Would it be amazing if we can be aware of this condition early before it is happening? Well, good news to us that we can. The answer you're looking for is genetic testing.
So what is genetic testing? Genetic testing is a type of medical test that identifies changes in chromosomes, genes, or proteins. The results of genetic tests can confirm or rule out a suspected genetic condition or help to determine a person's chance of developing or passing on a genetic disorder. The test can influence a person's choice about their healthcare and the management of the disorder. There are several types of genetic testing, including diagnostic testing, carrier testing, prenatal testing, newborn screening, and more. Through this test, it can diagnose many kinds of genetic disorders such as Huntington disease, sickle cell anemia, congenital hypothyroidism, and more. However, the epidemiological data on genetic diseases are not particularly available in Malaysia due to the lack of awareness and knowledge among health professionals and public. This results in insufficiency of rehabilitation services, unavailable of insurance coverage, and unequal access in educational and job opportunities. Like what happened to Mr. H here. His mother had genetic tests which showed to have the faulty gene of Huntington disease, in resulting of him having a 50% chance of developing the disease by inheritance. Huntington disease is a neurological degenerative disease that affects people between the ages of 30 and 50. There is no cure for this condition as it is progressive. Symptoms include deterioration in movement, cognition, and generalized functioning. That usually results from respiratory illness. Whether he is one of carrier or not, he pretty much loves his job as an air traffic controller and capable of doing his duties for years without a problem. So he refused to go through the genetic testing. The employer seems quite unaware of his family history. Thus, he faces with a few dilemmas on what action to proceed on. The first dilemma is to know or not to know, and when is the right time to do the test. It is a convoluted decision to make as the test can affect his life in most entire way. Hence, it is very important for Mr. H to seek for a consultation with medical geneticists as he or she can give an advice regarding the pros and the cons of the testing. If Mr. H decides to live in the unknown of his own condition, he pretty much prefers living in life in the dark, hoping that he will never develop the condition without any certainty. But it can be a quite sympathy in regard of Mr. H's situation, as he loves his job so much along with his fear, insurability of his employment status, and the stress he might face due to positive results and the lack of cure. In addition to it, Mr. H already experienced in witnessing his grandfather gradually suffer from the disease. He supposedly should use the chance to do the test as it can help him by relieving his worries or uncertainty. If the outcome of the result is positive, surely he can make a preparation for his future, like consulting with health specialists, participate in clinical trials and research, and staying alert with his symptoms. The best time for Mr. H to have the predictive testing is before the symptoms start to manifest. It is too late to do the test if the symptoms start to be visible.
Huntington disease, one of conditions that can impact the public safety, especially a job like air traffic controller, which require the motor, sensor, and mental function at the top condition. However, it still does not give a right for the employer to access any information on predictive testing, especially individual like Mr. H, as he is still able to perform his duty directly. If the employer have a right to obtain the information, most of the people will have the second thought on having a predictive testing as racial light to discrimination among the co-worker with the genetic disorder like Mr. H. Moreover, it is illegal to use the genetic testing information to jeopardize current health individual who has positive result.
The third dilemma is Mr. H is confused who actually owns the information of the test and who should decide who can access it. Like any other patient's health information, it is expected that only the patient should know about this and stays confidential unless it is required by law, patient consents, and justified in public interest. It is to ensure in building a bridge of trust with their practitioner and enhancing the patient-doctor relationship. The last dilemma is what action should be taken by Mr. H if he decides to conceive a child. If Mr. H has a negative result, he would not have problem in having his own children in the future. But in case of a positive result, there is a probability of 50% chance of his future children to inherit the genetic disorder. He had several choices if he chooses to have children. First is normal way. This kind of method is like flipping a coin in which he only can hope for the best of the outcome, resulting whether his child will inherit it or not. Secondly is performing prenatal testing following pregnancy, which involve detecting for any abnormalities of the fetus. The parents can choose abortion if the baby carries the faulty gene or continue the pregnancy, but that would take the child's right choice in getting tested in the future. Lastly is by pre-implantation genetic diagnosis, which involve conceiving a child through in vitro fertilization. The test requires screening of embryo for genetic disorder, and the normal embryo will implanted in uterus.
True and true, in general, it seems we can widely accept and acknowledge even the idea in development of genetic testing in discovering the alteration of genetic behavior of chromosome and gene. But in this particular case, it's hard to pinpoint which is the best choice among them. Seems we all agree upon the efficiency and consequence of any accessible choice. So, our point of view, the best plan we're able to come up with disposing the vital part of this information the world so they're able to recognize it a little bit better for the sake of the better acceptance among the general public.